going to ask you a whole different types of questions. For example, we like to know about any pre-existing health conditions you may have. We also want to know more about your habits. And we talk a lot about what's good for your heart is good for your brain. We want to know how much exercise are you getting? Are you eating your fruits and vegetables and eating a balanced diet? Do you like to read books, or do you consume a lot of alcohol? And all of these bits of information, as we put together here year over year, are helping us, again, better understand this aging process that we're all going through. Now, when I say aging, though, I do want to make sure that everybody on the call is aware this study is actually open to anybody over the age of 18, because we're all actively aging. So we want to try and get a big holistic understanding from anybody in these age groups. And it's also open to anybody in the United States who has an internet connected device. So the cool thing about our survey and the technology that it's using here is that this survey will work on your smartphone. It can work on your tablet, work on your laptops, your home computers, pretty much anything that can open up a web browser at this point, you can actually use to complete our online health history questionnaire. And I like to bring up our website here because, like I said, this is where it all starts. Our goals here are pretty lofty. For the Emory Healthy Aging Study, we're trying to get 100,000 participants. So far, we've had just over 30,000 people that have actually signed up. And one of the reasons why we're talking about this today is hopefully, at least give you the information to see that this is a way that you might be able to get involved in research if you've been a little hesitant or not really quite sure about what the commitments entail. And so I like to show the website, and I like to show the sign-up process because it's very, very simple now. We've broken this down into 4 steps. So when you visit our website, it's that healthyaging.emory.edu. And I'll also drop this in the chat box for you. But when you go to visit our site, if you were wanting to join, we have this yellow button here at the top that stays up there. And when you click on that, the sign-up process is broken down into 4 steps. So we have our registration, we have our consent, our contact information, and then finally that health history questionnaire. Now, the registration portion is important because this is done online. We keep and secure everything in our online portal. All the data is de-identified. We try to make sure that your safety and your information is protected as well as we can. We also go through the online consent process. This is basically letting us know, hey, I would like to participate in this research study. It's the same thing that you would do on site if you're participating in another study. We get a little bit of contact information from you. This helps us in case you move or, you just disappear. We need to, maybe reach out, make sure everything's okay, or seeing if you wanted to, finish updating your contact information. And then last, we have that health history questionnaire. And as I mentioned earlier, it takes most people about 25 to 30 minutes to complete. We're going to ask you a range of demographic information and behavioral information there. It's a great way to get involved. If you've got 25, 30 minutes of free time at any point during the year, you can help us in our research studies. And this information that we're also collecting can sometimes help us identify participants that might be a good fit for one of our Alzheimer's focused sub-studies. That is the Healthy Brain Study. And that one actually is involving individuals that do not have any kind of MCI or Alzheimer's diagnoses, who do want to take that next step and start coming in and getting a little bit more involved with the research process. That one does involve, sample collections, cognitive testing, and some MRIs. But again, that will not affect your participation in the aging study or your care at Emory. So I'm going to leave my email address and the web address as well in the chat box. If you have any questions about the study, you want to know more, or you just want to chat more about what we're doing with the research, feel free to send me an email. I'll be happy to talk more about it with you, and hopefully at least be able to provide some information that if not you, maybe somebody else may be interested in. Thanks, Cornelya.
Thank you, Whit. And so will you let the 6 call-in listeners know your email address?
Yep.
Before we turn it over to Ken?
Absolutely. So for those that are on the phone here, if you want to be able to email me, my email address is jefferson.morgan@emory.edu. That was jefferson.morgan@emory.edu.
Thank you, Whit. And Ken, I've turned it over to you. You are now a co-host.
Hello, everybody. I did not prepare slides today because I thought that the topics are more or less conversational in nature. And I'm hoping that just what I have to say, which is just sort of coming from my own perspective on things, will prompt conversation. And I know that Dr. Parker might want to pick up on these things as well. First thing I want to talk about is, so the CDC has relaxed restrictions around mask use. And I think within the course of the last 2 weeks, you and I have probably seen the same thing. Different different institutions, different organizations have responded in different ways. Costco now says, you know, if you've been vaccinated, the mask is optional. I went to go to the Mac store the other day, and they had somebody at the door saying, please put on a mask. So different institutions, different organizations are handling this in different ways. And so if nothing else, you should carry a mask. But how do you make some decisions for yourself and maybe for someone for whom you're providing care? And I think the way I think about it is to just sort of think about the odds and what are the factors affecting the odds, either of your being infected or you infecting someone else. Even if you have been vaccinated, assuming you've been vaccinated, the odds should be pretty low in both directions. At least that's what the current data suggest. So if you think about a small gathering of people who have been vaccinated, I would feel very comfortable. Well, in fact, I have been very comfortable in being with that group. I've taken great delight in being able to hug people again, people I know who have been vaccinated and who have been very safe in their practices. When I go to Costco, I wear a mask because I want to give a message to people who are not wearing masks who maybe haven't been vaccinated. Because I think we're now on a kind of an honor system, right? It says if you've been vaccinated, everything's okay. And people who haven't been vaccinated will take that, I think, quite dishonorably as a license to just not wear masks. So I want to guard myself against those people. And I want to send them a message that we have a responsibility to one another. Would I go to a Braves game? I wouldn't go to a Braves game. Too many factors, too many people who are maybe behaving in disinhibited ways, a lot less control in the situation, and less control in the environment. Would I go to a religious service? Depends, right? It depends on what the church or synagogue or masjid had set up as the rules. So if my church says we're letting in a third of the capacity, you got to sit 6 feet apart, and you got to wear a mask, I am really eager to sign up to do that. On the other hand, it's like, oh, we're back in business, come on in, I'd be really nervous. So that you begin to see what does the environment look like into which you are going to take yourself and your person. The science suggests that if you've been vaccinated, the chances of infection or being infective are low. So that's a good thing, but they're not zero. So measure your odds. The other thing Cornelya wanted me to speak about, or I wanted to speak a little bit about, is the decision by the FDA to approve the drug Aducanumab. I want you to understand 3 things. The large majority of the science panel that advised the FDA on this decision was opposed to authorizing the use of the drug. And that's because the criteria that are usually applied to the approval of drugs, 2 unambiguously successful trials, that criterion was not met. There were 2 trials of the drug. One failed. One didn't, but the one that didn't fail or succeeded only succeeded after a recalculation of a certain portion of the data. So I think it's scientifically shaky decision, likely prompted by an awful lot of lobbying. The second reason is the drug's effect is moderate to mild at best. It may slow things down. My work is with family caregivers. Family caregivers are desperate and appropriately desperate for something to be of benefit. So now you have something that's of small benefit. So they're going to want to do this without, I think, really being fully informed about the likely effectiveness of it. And the other thing that they're not fully informed about is what people are describing as mild side effects that will be experienced by 30% of those who take the drug. Those mild side effects are brain swelling and brain bleeding. And to monitor that, people on the drug have to undergo regular MRIs. Now, that's an expensive procedure, which maybe some people have coverage through insurance, maybe some will have coverage through Medicare, but maybe some are going to have to fork out, go into savings to do this, to put their person at high risk for what may be a very minimal or no benefit. And actually, there's a fourth reason. The fourth reason is that only people who are reasonably eligible for this are people who have mild cognitive impairment or very early stage dementia. It's not going to be appropriate for everybody. Just given the disparities in healthcare, this means that important groups of our population who are traditionally underdiagnosed or diagnosed very late will not be eligible. So there are disparities in who's going to get it. So you're going to hear a lot of people being excited about this. And I just want to throw a little cold water on that excitement. I have every wish that there's a cure and every hope that something will happen. But I want science to be behind it in a 100% way. So having been wishy-washy about my thoughts, I think I'll turn it over to Dr. Parker, who I hope will provide more balance to this presentation.
Thank you, Ken. I think there's nothing wrong with balance. I think we all need to have a healthy dose of reality. And a lot of times, as Dr. Hepburn pointed out, just because it's been advertised and just because it's been approved doesn't mean it's appropriate for you. So by way of trying to get back into who Aducanumab may be appropriate for, I'm going to briefly go over Dementia 101 for some people, just to kind of like reground you in terms of what we need to do. Okay, next slide, Cornelya. We know that Alzheimer's and related dementias affect at least 6 million people in the United States. You're more likely to get this disease if you are over the age of 75, nearly 50% of the people over 85. Again, next slide, please. There are nearly 6.5 million people in the United States with Alzheimer's or related dementia. Major risk factor is getting older. Next. Okay. What are, next slide, please.
Next. Dr. Parker, I made you a co-host too. That way you can advance them.
I don't know how. Okay.
Okay.
So this is,
slide you want.
yeah, okay. I'm just trying to give you some statistics. You can certainly go to the Alzheimer's Association website. I think that you need to know that dementia, Alzheimer's, or any other dementia is not a normal part of aging. And what makes it dementia and what makes it mild cognitive impairment? If it's dementia, you have difficulty with what everybody did on this call today to get up. You have difficulty getting yourself up, getting dressed, preparing your meals. transporting yourself from point A to point B. People with dementia cannot do that without assistance. Okay, next, please. It's real important to partner with your primary care physician simply because some things that look like dementia may not be. So what is measured when we have dementia? We like to say that your brain does things besides help you remember things. Memory is not the only thing that is affected when one develops dementia. On the left-hand side of your screen, you see 6 different brain functions. We call them domains. They are complex attention, executive function, learning and memory, perceptual motor, language, and social cognition. Okay, the importance of this is that if you have deficits in 1 or 2, in just one of these problems, we say you have mild cognitive impairment. So if you have some difficulty expressing yourself but can do everything else fine, you probably have mild cognitive impairment. You can do and take care of yourself independently. If you have deficits in 2 or more of these brain functions, if you have difficulty remembering things, if you have difficulty paying attention, processing information, planning and organizing, we like to say that deficits in 2 or more of these brain functions give you a diagnosis of Alzheimer's or a related dementia. Deficits in 2 or more brain functions is a diagnosis of dementia, regardless of how it may look. Next. There are several different types of dementia. And the next slide is a pie chart that shows you the most commonly diagnosed. On the left-hand side, you see 53% or more of the dementias that have been diagnosed are Alzheimer's. Then you have all these other ones. The next most likely dementia is Alzheimer's and a vascular dementia. Vascular dementia, which comes from having longstanding hypertension, high cholesterol, diabetes, frontotemporal dementia, which is wasting in the frontal part of your brain, disease with Lewy bodies, which is usually associated with Parkinson's disease. And then we have traumatic brain injury. Now, the importance of this slide, and I want you to look very carefully at the different types of dementia, is that the only disease that's likely going to be improved with any of the monoclonal antibodies that are being developed, including the one that was just approved, Aducanumab, is Alzheimer's disease. So if you have dementia because of head trauma or dementia because you've had strokes, Aducanumab is not a drug for you. Again, Aducanumab and the other drugs that are in development are being developed primarily for Alzheimer's disease. Everybody does not have Alzheimer's disease. They may have variations of something else that's located on the right side of the screen. Next, please. So up until yesterday, we really didn't have any kind of definitive treatment for Alzheimer's or related dementia. This is just a picture of brain shrinkage. And, you know, when you have Alzheimer's, your brain shrinks, and we call that neurodegeneration. On the right-hand side of your screen, this is a person who has Alzheimer's. You see how it's shrunken like Swiss cheese. And in the lower central part of the screen, you have degeneration of the hippocampus. You see a big vacuole or open area. That is pathologically identified with the development of Alzheimer's. Everybody who has dementia does not have a brain that looks like that. Underscoring again the importance of getting the correct diagnosis for the type of dementia that you have and making sure that the medications that are subsequently prescribed for you are efficacious and applicable. Next, what are some of the symptoms? Memory loss, repetition of words, wandering. When people's dementia becomes advanced, they start to wander. They become a little bit more irritable. They start to hallucinate. They have behaviors that are a lot of times a little bit more aggressive, and more importantly, they have a great deal of difficulty interacting socially, not only with their family members, but people who are outside their families. If they're drivers, they may start to have difficulty getting lost in very familiar places. They may have more car accidents because they can't judge distances and they're not aware, not able to respond appropriately to the lights and the traffic that they see. Next, please. In order to address behaviors or any of the things that I put on the other screen with respect to symptoms, you need to talk to and develop a good relationship with your primary care doctor. Why? Because your primary care doctor is the person who has to do and order the appropriate tests to make sure that what is causing the behavior is something that can be treated versus something that cannot be treated. Next. In addition to that, in addition to seeing your primary care doctor, you're going to want to see maybe an elder care attorney to make sure that the person who's starting to exhibit the strange behaviors has their business matters addressed. Somebody needs to be appointed durable power of attorney for healthcare to make health decisions for that person. Somebody needs to be appointed durable power of attorney for finance in order to pay that person's bills and manage their fiscal affairs. So dementia is not something that's just dealt with by a doctor. You frequently need a lawyer to kind of help you address those business things that are important to somebody who has dementia or not. Go on. Okay. We stress the annual wellness visit, but this slide is particularly important. There are different types of dementia, and we're undergoing research to try to understand how these different things interact. The greatest risk factor for Alzheimer's is getting old and being older. Other things that we need to do that are within our control are to manage our chronic illnesses and chronic behaviors. Things like diabetes, things like hypertension, things like anemia, chronic obstructive pulmonary disease, and rheumatoid arthritis. Managing those diseases well, because they're associated with inflammation, is one way to kind of get the jump on preventing dementia or parts of dementia that are reversible and treatable. Next. During the annual wellness visit, we get memory screens. So what are some of the things that protect your brain? What are some of the things that those of us listening can do right now? Number one, you can exercise 150 minutes of aerobic exercise a week. If you have heart disease and been told that you have high cholesterol, you need to take a statin medication. If you are hypertensive and you're at risk for that, you need to manage that high blood pressure. If you are diabetic, you need to manage your diabetes and keep it ideally managed. We want you to maintain social engagement and prevent social isolation, because those are things that are associated with the onset of some types of dementia. Hearing loss. Everybody should have their hearing screened and evaluated, because hearing is one of the ways we interpret the worlds around us. Depression. Untreated depression can masquerade as dementia, but people with advanced dementia may have symptoms of apathy, which we associate with depression. The good thing about depression, particularly if it's not associated with dementia, is that it's treatable. We like people to sleep. Adequate sleep is at least 7 hours of sleep a night. Maintaining a healthy body weight. If we're overweight, and all of us are healthy, we need to work on getting an ideal body weight. And what do you eat? I need to eat better. Okay. We have always said in our BrainTalk live sessions, what's good for your heart is good for your brain. So diets which are heavy in fruits and vegetables and leafy greens, not saturated fats, lots of fish, lots of poultry, not so much red meat, is what's good for you. You can look up the Mediterranean diet. There's something called the MIND diet, which is a combination of the Mediterranean diet and the American Heart Association's heart diet. So if it's good for your heart, it's good for your brain. And part of that is because a heart healthy diet prevents stroke-like symptoms, and stroke is associated with the onset of vascular dementia. Vascular dementia, however, is not something that is treatable with Aducanumab. Next. Okay, so how do we diagnose dementia? And this is what's going to be important, and this is what Dr. Hepburn was alluding to in terms of who's an appropriate candidate for dementia. So in terms of looking at what you need to do, if you're worried about somebody who's having or experiencing memory loss, they need to get to their primary care doctor to get a medication review, have an extensive evaluation with respect to their overall medical history. They're going to get screened and tested for thyroid dysfunction, diabetes, tested for syphilis, tested for vitamin deficiencies, vitamin B12, folate, and vitamin D deficiencies, and get a brain image, an MRI of the brain that will look for shrinkage of the brain and particularly hippocampal degeneration. There's a special machine called a PET scan, which Medicare does not pay for. It's only available through research, which is a definitive diagnostic tool for Alzheimer's. Now, when it comes to aducanumab, some of the studies in some of the indications for use of aducanumab is that you have a positive amyloid PET scan. All right, that is a diagnostic tool that they're using and determining. And again, unfortunately, this is something that's been made available primarily through research. We do neuropsych testing, which a PhD doctor does, and we examine your spinal fluid via lumbar puncture to look for A beta and tau protein precursors, which are found in Alzheimer's. If you have spinal fluid examinations that indicate that you have A beta and tau accumulations that are consistent with Alzheimer's, in addition to your brain imaging that looks like you have Alzheimer's, you may be a candidate for the monoclonal antibodies that are being developed and for aducanumab, which has recently been released. Again, you can't just go to the doctor and write a prescription, get a prescription for aducanumab, because that's not the way it's given. It's not a pill, it's an infusion. You have to go to a hospital or an outpatient center and have an infusion given to you each month. Next, please. So what are we using for treating Alzheimer's? Up until yesterday, all the medicines that you see listed here are medications that were used for symptoms. They didn't really reverse the disease. They're not disease modifying therapies. They're just things that kind of help with the symptoms for a short period of time. It didn't stop the disease process from progressing. Those medications are Aricept, known as donepezil, Razidine, which is galantamine, and Exelon, whether it's the pill or the patch. And then there's another medication called memantine, Namenda, that's been used in combination with the three above it. Okay, one of the cholinesterase inhibitors and memantine together have been used. Sometimes for other symptoms like irritability, for mood changes and difficulty sleeping, an antidepressant may be added to those above medications. Very rarely, and only if somebody has a psychotic diagnosis like schizophrenia, paranoia, or something, will they be given an antipsychotic medications. However, in nursing homes, people have been giving these antipsychotic medications to kind of change their behavior, which is not really something that we in geriatrics or in medicine in general advocate for people with dementia. So right now here in the United States and around the world, there are a whole lot of companies that are doing Alzheimer's drug development. So on this particular sheet, you can see that there are about 121 different therapies in investigation. There are 136 clinical trials, and there are a whole bunch of drugs that are in different phases of treatment. We know that phase 3 drug testing, which is what you learned with COVID-19, is one of those drugs to see how well the drug actually works in people. Phase 1 is we're determining whether this drug is safe and may be applicable to people. And phase 2, we're titrating up the dose to figure out what the most effective dose of a medication is. So the next slide, please. I think this is a written thing of what we're talking about. But right now, there are about 121 different drugs that are in clinical trials that are looking at treating Alzheimer's dementia. I didn't say vascular, I didn't say Lewy body, I said Alzheimer's, okay? 10% are treating memory, trying to help improve memory. 10% are designed to address behavioral and neuropsychiatric symptoms, the wandering, the irritability. And 80% of the drugs that are in development are now treating Alzheimer's disease or trying to adjust the trajectory of Alzheimer's disease. These are 10 different monoclonal antibodies or biological treatments that are being used for treating Alzheimer's. The first one of these drugs that's been approved by the FDA is aducanumab. Aducanumab. Okay, next. There's another one by Lilly called donanemab, which is also under development, but is soon to get FDA approval. Okay, let's talk about these disease modifying therapies. I talked about 10 monoclonal antibodies that were in research development. Well, now they've approved one of those, and that's Aducanumab, brand name Aduhelm, which is designed to clear the protein accumulations of amyloid in your brain. It's not clear that it necessarily restores clinical function, but more importantly, if you can decrease the amount of amyloid that accumulates in your brain, the likelihood that you will have greater clinical function is better. As Dr. Hepburn, he likes to say, he poured water on it. That's really not pouring water, that's reality. The reality is that some of the first drugs out of the gate for treating a disease may not be therapeutic in and of themselves, but they do offer a little bit of help. As some of these other drugs come to market, maybe a combination of them will work to kind of help really stop the progression of the disease. As Dr. Hepburn mentioned, part of the monitoring that goes on for being treated with this new drug involves an MRI. An MRI at the start of the drug, an MRI after the 7th visit, and an MRI at the 12th visit. Okay, right now these drugs are going to cost $56,000 a year. And as of yet, Medicare is not completely covering the cost of all things involved with that. And that's one of the things that Dr. Hepburn was alluding to. If you don't have health coverage that will cover some of these things, chances are you may not be eligible for this, but the drug company is working with people to try to make sure that there is no out-of-pocket cost or expense for getting treated with this medication if you meet appropriate criteria to receive it. Now, the other drug that I have on the other side, Donanemab, I don't know what their brand name is going to be, works pretty much the same way Aducanumab does. It says that it delays the progression of disease by 18 months. It has the same kind of indications and issues that Aducanumab has. The problem with all of this is these drugs are still in development. If you've not been involved in a clinical trial, chances are you're not going to be eligible to get a lot of these things unless you meet a lot of criteria for getting the drug in the first place. A doctor like me, while I think I'm fantastic, is not going to be able to write a prescription for Aducanumab or for Donanemab if you don't meet criteria. It's not a drug you just give somebody because they're having memory loss. Again, there is specific criteria, specific diagnostic criteria that indicates that you can or cannot have this medication. And Aducanumab requires definitive diagnosis of Alzheimer's pathology. And as Dr. Hepburn said, it's not for the people who have well-engaged dementia. It's for people like me, like any of us on this call. We don't look like we have Alzheimer's, but we may have the precursor protein circulating in our cerebrospinal fluid and in our systems. And we've proven that by using blood biomarkers, or maybe we've had an amyloid PET scan that shows that we have amyloid accumulating. For people who are asymptomatic, who are not showing problems with any of their brain functions, that is who this drug is intended for. If we're like we are on this call, I'm functioning, I can give a talk, I can follow instructions, and I have evidence of this Alzheimer's pathology in my brain via PET scan, I may be a candidate for that drug. The person who is not a candidate for the drug is somebody who's already showing symptoms and signs of disability. They can't take care of themselves. They can't be living by themselves. They need assistance with all activities of daily living. The other thing that you need to appreciate is this drug is not a miracle drug. It's not going to instantaneously restore you back to normal function. Again, I look normal, but maybe if you look at my brain on a PET scan, I have signs and symptoms of amyloid accumulation. Well, this drug would be for me because I don't look like, don't act like, and don't seem to have any symptoms that go along with the pathology that may be developing in my brain. It is not for your mother, your grandmother, your father, who has well-defined symptoms that are consistent with dementia. Anybody who's incontinent, anybody who's incapable of living alone by themselves and requires a lot of assistance with care is not a candidate for this drug. That's why through the Emory Healthy Aging Study and other research studies, we're identifying people who may have pathologies in their brain that they're not aware of, people who have mild cognitive impairment, so diagnosed via research studies, All of those things are important. The important thing is this drug is not for everybody, and everybody's not going to be able to get it.
Awesome job, Dr. Parker. Thank you so much. Very, very helpful information and very timely considering the announcement yesterday. And I know that there are probably more questions. We do have a comment that said, this is so helpful. Thank you so much, Dr. Parker. Thank you for your relatable approach to it. So if you have additional questions or comments, please send them to us in the chat. We see that it is 5 minutes to 3. So we want Matt to come in and talk about the CEP live today and who will be on really quickly. And if you guys have time and able to stay on with us, please do send your questions and comments in the chat. And then we still have Miss Shirley Thomas, who, if you were on last week, she still has some great information for you guys. So if you guys can hang tight with us, and we're going to let Matt speak briefly, and then we'll continue on with Miss Shirley. Matt, take us away. You're muted, Matt.
Sorry about that.
There we go. No problem.
So today we're gonna have Margot, our nutritionist, and we're gonna be talking about the MIND diet and a few other things related to different types of diets for both that's great for your brain and also for your heart and body. And yeah, so I will be posting a link in chat here if you have not participated on how to register and come see us in a few minutes. Thanks, guys.
Awesome. So thank you, Matt. We appreciate you. We'll see you next week. And we're going to go ahead and switch to Miss Shirley. Hey, there you go, Miss Shirley. Hey, I like those glasses. Very
Good
nice.
afternoon. Thank you.
Good afternoon.
Thank you. I will try to be quick. Right?
Yes,
but
and take your time because the information is so great. That's why we're having you on back. So take your time. The audience knows that we're going to go over 3. So please continue on.
Okay. Well, last week, I talked about the resetting of the nursing home days, and I want to be able to give you the phone number and the agency to be able to contact that should you run into that issue. But first, let me talk about the Lyft rides to COVID shots. The National Council on Aging and Lyft have partnered together, and they are providing $25 value rides to and from COVID vaccination appointments. And now it is so easy to get a vaccination. I've noticed that a lot of the larger centers have closed, like the World Congress Center has closed because you can get them now. And there are no location restrictions as long as you stay within the range where the ride would be $25. But if you can get them now at the Walgreens and the grocery stores, and so that should not be an issue at this point. The rides and the vouchers are good until December 31st. So from now to the end of the year, you can get a ride. You must have the Lyft app on your phone or computer in order to order the ride. And the code. It doesn't matter if you're getting dose number 1 or dose number 2, there is a code for it. The code for dose number 1 is Senior Vax 1. That's SENIORVAX 1. For the code for the second dose would be the same, except the number is 2. So that's Senior Vax 2. SENIORVAX 2. And when you give that code, you qualify for $25 toward the ride to the vaccination appointment. Now, I did send over some slides that had the phone numbers so that I could give the phone numbers for the agencies I was talking about last week. Do you have that?
Not at the moment, Miss Shirley, but we can see if we can get it pulled up. Continue talking. I'm putting the codes in the chat for you.
Okay. So the assistance for the reset of the nursing home days. So if you run out of your 100 days and you need another 100 days, would be the Beneficiary and Family Centered Care Quality Improvement Organization. Well, that's a lot to say. Here, we call it KeyPro. So in the state of Georgia, we call it KeyPro, KEPRO. And the phone number for them is 1-888-317-0751. Again, 1-888-317-0751. Now, the FCC is there in case you have been a victim of a scam or people keep calling you and you have their numbers and you can let them know that people have been trying to scam you. They are trying to get the COVID cards now. And as you see, there are a lot of benefits to having the COVID card. There are a lot of places you can go and you can travel. And the governor has signed an executive order saying that it's no longer necessary. You don't have to show that proof. But that does not mean they're not trying to steal these cards, because there are still things going on where people want you to have a mask, or they want you to prove that you have had the vaccinations. Okay, no, you've probably read or heard about the concert that's going on in July in the St. Petersburg, Florida area. If you've had your vaccination, the tickets are $18. If you have not been vaccinated, you can still attend the concert, but they're going to charge you $999 for the ticket. So people are stealing the cards so that they can pretend like they have had the vaccinations and they can get it for $18, get the tickets for $18. So things of that sort are still going on. The FCC's phone number is 1-888-225-5322. Again, 888-225-5322. They also have a video phone so that you can speak with someone and look at them at the same time when you're sharing your information. And that number is 1-844-432-2275. Again, 844-432-2275. Now remember, the government will never call you and threaten you and ask you to pay a bill immediately. That never happens. They will not do that. So beware of that. Do not give your personal information, your card, your bank information over the phone unless you have called the person for the help and you know who they are. Do not respond to calls and texts or unknown numbers. And even if it's something that came from a friend, but you're not sure, call the friend and find out, what is this you sent me? Don't open up the link. If the friend sent it to you, then they know what it is. If they were hacked, then both of you are aware that there is something going on. There's a scam going on. If there is an agency, they should have a phone number and a website, and you can go online and look up the agency itself. If someone claims that they're a charity, you can check with the Better Business Bureau to make sure that they are a legitimate charity, and the money that you would give would actually go to the agency or the cause that you want. Now, the other thing I want to share with you are the, did you find it? Are the
No, ma'am, not yet.
Okay.
You're doing great. I'm putting all the information in the chat as you're talking for all
okay.
the participants.
The Consumer Financial Protection Bureau has tried to help, has a program to help with the scams. There are some people that are saying that they will buy your house, or because of COVID, they will fix certain things on your house and they're getting your information. Well, don't trust that. Consumer Financial Protection Bureau asks that you check with their site and find out legitimate agencies that will assist you with certain things. If your insurance does not cover the modifications, as we spoke of last week, there are other programs. The website for that is www.consumerfinance.gov/coronavirus. Materials can be gotten in Spanish, Korean, and Chinese if that is needed. if you need someone to run errands for you and people are coming up saying they'll run the errands and get your money and they never come back, check with the elder locator. And that is 1-800-677-1116. That's the elder care locator. The website is www.eldercare.acl.gov. Scammers pass out your name and phone numbers to anyone that they have successfully scammed. They pass it on to other scammers. So that's why I want you to know, be aware. And the last but not least, the COVID-19 funeral assistance through FEMA. If you were not aware of that, FEMA is providing up to $7,000 toward the funeral cost. So you can go online, go to FEMA.gov/funeral-assistance/FAQ. Or you can call 844-684-6333. That's Monday through Friday from 9 in the morning to 9 at night. If there has been a death due to COVID, they are requiring the death certificate, and it must say due to COVID or due to complications brought on by COVID-19. And you can submit the documentation or a copy of the death certificate through disasterassistance.gov, or you can fax it to 855-261-3452. Again, fax, not phone number, fax 855-261-3452. And to mail it, you can mail the information to COVID-19 Funeral Assistance, P.O. Box 10001. That's 3 zeros, 10001, Hatesville, Maryland, 20782.
Is that Hapesville or Hatesville? Can you spell?
HYATTSVILLE.
And what's the state and zip?
Maryland, 20782.
Okay, thank you.
Okay, and that's it. I didn't take you too far over 3 o'clock.
No, ma'am. And a couple of great questions came in. One was about the $25 with the codes. Someone asked, is that round trip for the shots, the $25?
It's $25 each way. And yes, you do qualify. You will get the entire $50.
Okay. And regarding the Lyft rides, what happens if the ride exceeds $25? I assume the person is charged the difference?
The person is charged the difference. And that's why I'm saying, because vaccines are more readily available now, you may not exceed that $25.
Okay.
And the good thing about these Lyft rides also, I've had people that live in Clayton County, but the clinic is in Henry, and transportation is difficult to get because it's out of the county. This Lyft ride will cover, and you can go out across your county line. So it will cover that.
Okay, and then one more question we had here is that my understanding that the federal government will pay for any COVID testing. Should there ever be a cost to take a COVID test, even if it's a rapid test on site for an organization?
No cost for the testing, for the vaccine, no cost at all. No cost to you. They may ask for your a copy of your insurance card, your Medicare card. That's because they're going to bill the government, and they're going to let the government know that they gave that vaccine, and they have to put the vaccine number out of the little vial next to your information.
Awesome. And last 2 questions, and we're going to let you go. You had such great information. They keep flowing in. How do you get a death certificate in less time than a month?
I don't know the answer to that. Sorry.
Okay. No problem. It was worth a try. It was worth a try. And then lastly, is there anyone that can help with getting visitation in the facilities back?
They are working on that. Yes, there is an agency, the National Council on Aging, the Ombudsman organization. They are trying to work on that. But as the doctor said before, there's so many people that have not been vaccinated, and you may be asymptomatic and you may have had your shots, but someone else may not have. You could be a carrier, and that's really difficult.
Okay, and then very last question. Are these services specific to the state of Georgia? My best friend and I are helping support one another, and she's in Michigan caring for her 93-year-old mother. Is there—
No, it's nationwide.
Nationwide services? And
Yes.
What's the main website where people can find more information from what you do? Can you provide that? Can I provide it in the chat?
The what?
Like for
Georgia
like
Care?
Yes.
Okay, Georgia Care's website is www.mygeorgiacares.gov. And my phone number, I guess I should have given that, is 470-552-3162. Shirley Thomas.
Perfect. Well, thank you again, Miss Shirley, for coming on. Again, this is vast information, and the beauty is that we have this recorded. So Cornelya will send this out to our participants, as well as the PowerPoint. I think you sent it to her, so I wasn't able to pull it up. But we thank you for carving out some more time this week to give the vast information to the general public. They greatly appreciate it, and so do we.
My pleasure.
Awesome. Well, thank you all again for sticking on with us. We appreciate your time and attendance. We hope you all have a lovely day. Same to you, Miss Shirley. We'll catch you all back next week. Take care.